There is nothing more tragic than the death of a child, especially so if the death was preventable. And that is how we begin tonight.
With the death of a child in Texas from measles, the first measles death in this country in nearly 10 years.
Measles deaths, even measles cases, are rare because the disease is preventable with a vaccine that has been available for more than 60 years.
There is an outbreak of measles in Texas among people who were not vaccinated. That includes the child who died in Lubbock. Omar Villafranca is there for us tonight. Omar.
Good evening. This outbreak is really impacting how hospitals treat their patients. Here at Covenant, they've set up a hub outside of the ER so someone with measles doesn't walk in and expose other people.
You're now seeing a very serious consequence of what happens when we have measles in our community.
The first measles death in the U.S. in nearly a decade happened here at Covenant Children's Hospital in Lubbock, Texas.
The child was school-aged and did not reside in Lubbock County.
There are now more than 120 measles cases in Texas. About 20 children have been hospitalized, some in the ICU. None were vaccinated. Now health officials are racing to stop the spread.
We've talked to parents of little ones under 1 year old who can't get the measles vaccine. What do you tell those worried parents who feel their kids are susceptible and they don't even want to take them out?
It's important to communicate with your physician for infants, especially 6 to 12 months. So that population is a little bit different only because we can, in certain contexts, give the measles vaccine early.
Before the MMR vaccine was introduced in 1963, 400 to 500 people died every year. The virus is extremely contagious for those who don't have immunity.
Saturday morning, she woke up with a rash.
Knowing the measles outbreak was near her home in Odessa and that her daughter was too young to be vaccinated, Caitlin Norris took 8-month-old Poppy to the ER when she developed a fever and rash.
She also had the coughing, the runny nose, and the rash. So she had a very good amount of all of the symptoms.
You're so sicky and you don't even know it.
Despite her symptoms, Poppy's test results came back negative for measles this morning. But her mother isn't letting her guard down yet.
When you start hearing about this in your backyard, what's going through your mind?
It's terrifying. I've read a lot of things about how children have seizures because of the high temperatures of their fevers and brain damage, and they die, and it's terrifying.
Today at the White House, HHS Secretary RFK Jr. mentioned this outbreak and said some of the hospitalizations here were for quarantine. Well, doctors here tell me that is not correct. They say everybody who's here at the hospital is being treated for respiratory issues.
Omar Villafranca in Lubbock, Texas for us. Thank you, Omar.
Our chief medical correspondent, Dr. John LaPook, joins us now. And to be clear here, John, measles are seriously contagious.
So infectious. Much more than flu or COVID. And on top of that, there's a double whammy, which is that there's a relatively long incubation period of 10 to 14 days, during which somebody can travel all over the place, even up to 4 days before getting a rash, and infect other people. On top of that, if an infected person leaves a room, the virus can be floating in the air for 2 hours and infect some unsuspecting, vulnerable person who then walks in.
So given all that, John, remind us again of how effective the vaccine has been.
Extraordinarily effective, 97% effective at preventing infection after 2 doses. And take a look at this graph. The measles vaccine was introduced around 1963. That's when it was licensed. Before then, there were about 500,000 reported cases a year and 400 to 500 deaths. Now look at that precipitous drop-off. I mean, you don't see something like that. And so that's remarkable. Now, I do understand there are people who say, and they've said to me, look, I don't want to get the vaccine, and I don't want to give it to my family. I'm rolling the dice for them and for me. But actually, when you say that, when you're considering whether to get the vaccine, think about the fact that there are 17 million immunocompromised adults and 2 million immunocompromised children who are relying on you being immunized and getting that herd immunity to not get infected themselves.